Stigma is a huge barrier to accessing methadone. There's so many layers to it. Opioid use disorder stigmatized, using medication to treat it stigmatized, and of those medications, methadone's the most stigmatized. And we see it enacted in so many places. So old federal rules that require daily dosing, state rules that still require that, and clinic policies that do too. And clinic patients talk about experiencing stigma when they go to get care, being judged for continuing to use, even though we know that substance use disorders are recurring conditions and a return to use is normal. And then finally, clinics can set their own policies. So even if a state wants to make methadone as easy to access as possible, the clinic can say, we're going to put a lot of rules on it anyway. It's very hard to be contented with the status quo when you hear stories about people having to miss Christmas morning with their daughter because they have to go to an OTP. So you can't get methadone in a pharmacy. Then the federal government sets rules around what care looks like in those facilities. States also set their own regulations, and there's nothing stopping them from putting even more rules on top of that care. Methadone treatment was originally established not to help people live healthier lives, but instead to control crime. People who have experienced a methadone treatment absolutely need to have a seat at the table. They're the ones who can tell us how the current system is negatively impacting their lives and can tell us what would make care better. Pew conducted some research to look at how methadone is provided in pharmacies in other countries. We looked at Canada, Australia, and the United Kingdom. And what we found is that those countries experience really positive results from their treatment system, including a lower risk of overdose, lower involvement with the criminal legal system, decreased transmission of HIV and hepatitis C. So if policymakers are interested in pharmacy dispensing, there are other countries we can look to. So one barrier that patients face is something called administrative discharge. Administrative discharge is a fancy way of saying kicking people out of care. All OTPs in the country, except maybe in Massachusetts and Ohio, can kick patients out for things like missing a counseling appointment, for having a positive urine drug screen for any substance. So alcohol, marijuana, even if cannabis is legal in the state. When neighborhoods fight against opening an OTP, even though we know it would serve people living in those communities. There's so many ways in which stigma makes it harder for people to get the care that they need.